everyone. Oh my goodness. I have lost track of what day I have been in quarantine. I think I'm somewhere around the 100-day mark. And we just learned from Governor Newsom here in California yesterday, which was May 15th, that we are probably going to be in self-isolation till July, if not longer. So I'm just trying to keep my anxiety at a minimum and try to keep myself busy, stay positive. I am enjoying being in sweatsuits every day. I really am so in love with this particular tie-dye sweatsuit from a young businesswoman, Clem Tie-Dye. Her proceeds of her sales, a significant portion of them are going to COVID relief. So please check her out and support this small business owner. But today I want to talk to you about alternative medicine and, just other avenues that, you can kind of think about or consider when you're looking at the whole picture of your care. For me, I was really struggling with getting on a disease modifying therapy or getting on a lot of the MS drugs that you might have heard of, just because of the things that I've read about and seen when it comes to side effects, how you kind of start that slippery slope of once you start one round of meds, you wind up needing medicine for something else and new ailments kind of come up. And I just really didn't want to begin that road. And so I really made an effort to figure out, okay, what could I do to make myself feel more comfortable if I were to go ahead and start some of these drugs like Ocrevus or some of the other MS drugs that a lot of doctors recommend. And so did some research, and I found what is probably the thing I miss most in terms of where I go outside in the world, and that is Next Health.
Okay, so I am headed into Next Health, which is like a holistic kind of operation where you can get IV therapy, you can get vitamin D shots, B complex shots. I'm just trying to figure out what I can do to help myself, outside of what is happening with my doctors, and just looking a little bit more into some Eastern medicine. And I just can't wait to hear what you guys think and what you've done. Today I am getting a Super B shot along with a CoQ10 shot, and I'm getting a baseline test, which is going to just kind of test all of my levels, check on my liver, especially with all of these MRIs with contrast, the trilipital that I'm taking for my trigeminal neuralgia. So all of these things, just want to make sure that I'm not going to get any more problems, to my body outside of what's happening with the MS. So this, I'm hoping, is going to be really helpful. And then next week, I will be able to move on to, IV therapies, which I will talk to you more about as well. Oh, last thing, I'm also going to do the LED bed, which is supposed to help with detoxifying and getting rid of that contrast out of my system. So I'm going to let you know how that goes too, and we'll go through it together.
There is a location in West Hollywood, a few more in LA, as well as New York City. And I mean, it's just a candy store of wellness, and I just love going. I had such a great time there at my first, experience, and I wasn't really sure what I was going to find, and it was so much fun. Once I really got down to what it is that they offer, I sat down with their in-house nurse, Joseph, and we started off with a blood test to just measure all of my levels and just see where I was at in general kind of like health. And I was really pleasantly surprised and learned a lot from it. It turned out that my test results, for the most part, proved that I was a healthy individual outside of my MS. There was no thyroid issues. There was nothing going on that proved any type of fear of diabetes. I was hydrated. Everything really kind of read that I was maintaining a healthy lifestyle, which was great to hear. But we did discover some deficiencies. And so I want to just kind of talk to you about it and see if it's something that you might be experiencing as well, and something that you might want to look into. So the first was vitamin D, which folks with MS, we are vitamin D deficient pretty much like off the cuff. And if you are a person of color, that's going to make you even more deficient than a typical person with MS. For whatever reason, people of color just have lower levels of vitamin D, just off the break. And I was frustrated though, because I had been on a vitamin D supplement for several months because my neurologist had recommended it. And I didn't understand why my levels were still so low. And it turned out that women, specifically, our bodies sometimes don't absorb the supplement that we're taking when it comes to vitamin D. So, you're taking this, vitamin or this pill every day, and you're thinking you're, kind of getting things in line, and your body, it's just not kind of getting into your bloodstream. So he recommended, instead of a pill form, doing the liquid vitamin D drops, which I have here for you, as well as coming in once a month for a vitamin D shot that goes directly into like your bloodstream. So I've been on that for a few months. I'm excited to go back in another 3 months and kind of see where my levels are at, and see what progress we've made. An important thing to note with vitamin D, especially during this time, is that there have studies have shown that patients with the coronavirus that have a vitamin D deficiency wind up with more complications with the virus. So for us, we really want to be diligent and find out what it is that we need to do to make sure that we are prepared and equipped in the worst case scenario that we were to, come down with the coronavirus. We want to be as prepared as possible. So make sure you're figuring out how to get the right vitamin D, amounts into your system, and making sure that they're staying there. Another one that was really interesting was testosterone. It turned out I had really low testosterone levels. And so for women, testosterone, I didn't really know the details of this. Testosterone really helps us with the maintenance and growth of our bones. It also increases our muscle mass. It decreases our fat. So if you've noticed that, like, you've been trying to lose weight or, drop a few pounds and the scale's not really moving, or you feel like you're plateauing, it could be that you maybe need a little bit more testosterone. It also helps with that decreased kind of vaginal atrophy, is what they call it. And so it really ties back to my episode on fertility of levels being low due to MS. Testosterone can kind of help, balance that out. And then lastly, it helps with heart health. So that was something that was super interesting that I wasn't aware of. And so I'm now on a testosterone supplement, and I have definitely noticed the difference. It has really helped with my MS fatigue. It's certainly helped, I've noticed, on the scale. I think we're battling a lot with steroids and things that we're putting into our body where, the scale just kind of keeps climbing. I have certainly noticed the benefits of being on testosterone supplements. So certainly something to consider bringing up with your doctor the next time that you have an appointment. And then lastly, turmeric. I think that, a lot of people know, outside of autoimmune disorders, that turmeric is really an anti-inflammatory aid. And so, whether that's doing a turmeric ginger tea or actually doing a turmeric supplement, this is something that's key to keeping your body, less inflamed. And so all of these kind of things, the hope is that you're taking your Western medicine that's supposed to kind of keep you less inflamed, keep lesions from coming back, but you're trying to do something else on the holistic side to keep your body overall less inflamed, so that you're not having as many flares, you're having, better symptomless days. And that's really what I was looking at, is what I could do on my side of things to kind of combat this disease outside of what my doctors were already offering. And it's really, for me, been such a relief. It's such a place of just kind of self-care and wellness. There's so many things to do at Next Health. I love the LED beds. That's something that really helps with your nerve pain. If you can find a place that has LED beds, there's particular settings that you can have the LED lights to focus on nerve pain. And it really is an immediate relief. Cryotherapy also helps with that inflammation. You know, there's just so much that you can kind of do to help bring those levels evened out in your body that doctors don't really tell you. The hyperbaric chamber is an extreme pressurized oxygen tank that helps with making your cells healthier and you know, giving you the oxygen that, you know, you're supposed to have that we don't really get out here in our day-to-day.
Look at this thing. It's like I'm in a spaceship. It's plenty of room, so even if you're claustrophobic, you can stretch out.
And so whenever someone comes to town, I bring them to Next Health. My mom's done cryo with me. Girlfriends come, you get wellness shots, you know, IV drip bags. It's just a really kind of added level of self-care. I know that we do baths and spas and facials, and that's always something that we talk about with self-care, but you know, really working on wellness and getting yourself as whole and as healthy as possible from the inside out is going to be so huge and make such a difference for folks like us with MS. And so I really hope that you will consider and take the time, talk about it with your doctor, do your research, and just find out, you know, what other options are out there for you, because it's really helped me a great deal. So I hope this helped. Try to stay strong. We're in this together. I know that we're going to get to the other side of it. I can't wait to get outside, and just stay safe, guys, and please make sure to subscribe. Thanks.